The following video provides a range of examples about services that are either provided by East Sussex Adult Social Care or delivered on our behalf, services that help support residents.
I fell and broke my leg 2.5 years ago. I had 3 hip replacements and then it dislocated again. It didn't heal very well. They'd taken out all the hip replacements, so there's nothing there at all. They just fused the bone, they call it a girdle stone, whatever that means. And so really I've just got to learn to walk again on it as it is. Well, we go to the gym every morning and we have activities with the whole group, and then the physiotherapist does walking activities with me, trying to strengthen my leg, walking up and down the parallel bars, forwards and sideways, and practicing. I've got a little step in my flat, so we practice going up and down the little step. So it's really doing what we need to do. I mean, other people need different things. They've got more steps, so I think the physios practice using more steps, and you know, everybody's different, so I think that the physiotherapy is tailored to our needs. It's a very nice place to be. It's much nicer than a hospital. The food is excellent. The attention we get and the carers are very good. Well, I'm hoping that my leg will get stronger and that I can go back home and begin to lead some sort of a normal life again.
From the Association of Carers, Kath comes and visits with us normally on a Thursday morning. There are a number of areas where Kath's support helps us. One is that I get to do things that entertain me. So we've got the Kath Houghton patio out the front there. We've got the Kath Houghton compost bin out the back here and things like that. So I get to do things that entertain me. And there's somebody else around besides us and the immediate family who has a perspective on Jackie and how she is, how we are together.
Where did we go today? We went to Bexhill.
So, yeah, that's right. And
walked along the seafront.
Oh, the first.
I looked at the flowers and we went to the park.
Yeah.
And walked around the park.
The park.
Yes, wasn't it? We went on the gym equipment, didn't we? You were laughing at me, weren't you?
Extra care housing is a type of housing that's provided in partnership between the local authority and registered providers. This type of housing allows people with varying levels of care needs to live independently in their own flats, whilst having additional 24-hour care and support available on site when it's required. The people who live in extra care housing have their own self-contained homes, but there are also communal areas such as a restaurant, activities room, buggy store, therapy suite and lounges. Many of the schemes also offer a range of activities that can help to maintain the independence of residents. There are currently 5 extra care schemes across East Sussex, and the government has recently announced funding for a new £10 million development in Bexhill that will offer 58 flats and provide additional space for local community groups to meet. Safeguarding adults who are at risk of harm is our most important priority, and this underpins everything we do. Our aim is to enable adults who are at risk of harm, abuse or neglect to live as independently and safely as possible and have control of their lives. When we talk about adults at risk, we mean anybody who's 18 or over who has social care or health needs and who's unable to protect themselves from harm. Abuse can come in many different forms and affect people in different ways. It's our responsibility to make sure people know how to raise concerns of abuse so we can investigate these concerns and provide appropriate support. If it's decided the concerns need to be investigated, we will speak to the person who's at risk and find out what they want. We'll support them to deal with the situation and help them to keep safe in the future. Sometimes the adult at risk is not able to make their own decisions, so in these cases we make sure there's someone who can represent them. We'll work with other organisations such as healthcare providers and the police to fully investigate the situation and develop a safeguarding plan which sets out how any risks of further abuse will be prevented. We believe that safeguarding adults at risk is everybody's responsibility, so if you've been abused or think someone you know has been, please let us know.
East Sussex, like other authorities across the country, faces a number of significant challenges over the next few years. Our key priority is to continue to provide services that meet people's needs and to continue to ensure that we build services around the individual to make sure services are personalised and will be able to respond to what people tell us is important in their lives. We will, however, be having to do that within a very challenging financial climate. We have to make £8 million of savings in 2013-14 from a budget of £231 million. Over the 3 following years, we will also have to make significant savings. Therefore, it's very important that we continue to focus on re-ablement. To provide support to people, that means that we can address their immediate needs and help them become more independent and reduce their reliance on long-term services. We also need to review how we spend money on preventative services, because it will continue to be critically important for us to prevent people's health and social care needs escalating. This will help us manage the resources that we have available. We also want to help people become less reliant on publicly funded services. To do this, we can ensure people receive the benefits to which they're entitled, but it will also mean all of our efforts in terms of the delivery of services and the focus that we give through support planning will be on ensuring people are able to achieve maximum independence and are actually able to look after themselves with the support of families and with the support of their communities when that's necessary. Throughout all of this, we will need to work in close partnership with all of our stakeholders. That will be the other agencies that are responsible for the delivery of services through the NHS and boroughs and districts, police and probation. But it also means that we have to work with our providers and with carers and clients to ensure that we're focusing the resources that we have in the best way we possibly can. We do have significant savings to make, but we want to involve all of our stakeholders in making the choices that we have to in future years, but also monitoring and evaluating the impact of those choices to continue to refine the adult social care offer within East Sussex. Finally, we have to bring attention to how we integrate our services with health. This is a key government driver, but it also reflects a local priority from the County Council and the local clinical commissioning groups. We have to ensure the commissioning of our services is fully integrated and also the delivery of those services. We believe that will help us make the best use of resources, respond to what people tell us is really important in their lives in terms of joined up provision, and actually have a positive outcome for local residents and make a real difference in both their health and social care and general health and well-being.